Hi, this is Dr. Hadya, and I'm willing today to present the study that I had conducted with my colleagues in Egypt, which is discussing the predictive factors affecting stress among nurses providing care at COVID-19 isolation hospitals at Egypt. The outline of the study will start with the introduction, materials and methods, results, discussion, and finally conclusion. The 2020 coronavirus widespread in Egypt is a portion of a continuous widespread around the world. The primary cause of COVID-19 in Egypt was confirmed on the 14th of February 2020. Throughout the COVID-19 pandemic, nurses are experiencing fear, pressure, tiredness, ongoing emotional trauma, and isolation. This ongoing trauma and stress impacted the nurses' mental health, feeling safe, and providing the finest possible care to their patients. Stress can have a significant impact on individual nurses and their ability to accomplish tasks, poor decision-making, lack of concentration, apathy, decreased motivation, and anxiety may harm their job performance and creating more errors. The study aimed to examine the predictive factors affecting stress among nurses providing care at COVID-19 isolated hospitals in Egypt. The method of the study, it was a cross-sectional study, which was conducted at 5 different isolated governmental hospitals for COVID-19 in Egypt. And these hospitals include intensive care units, medical rooms, and well-equipped with ventilators, cardiac monitors, defibrillators, crash carts, besides all personal protective equipment. Symptomatic patients attended firstly to triage hospitals, which was identified by the Ministry of Health. Then swabs done for them, and they transfer the patients to isolated hospitals after the positive swabs are confirmed. And then the Ministry of Health informs the patients with the closest hospital to their residence. The study subjects were selected among nurses providing care for patients at COVID-19 quarantine regardless of their age, gender, qualifications, and experience. 524 was the total number of nurses in the 5 selected hospitals. 374 nurses were selected using the convenient sampling method. All participants are asked to fill an electronic questionnaire sent to their mobiles for commitment to social spacing, and after spending a period of 14 days in COVID-19 quarantine hospitals, and also after explaining the purpose of the study and confirming the privacy of the data. With regards to the instruments, characteristic forms, factors affecting the nurse's stress, and the nursing stress scale were used to collect the data. One tool was developed and used to collect the data after reviewing the related literatures, and then it was translated into Arabic language. Reliability and validity were done, and it included 3 different parts as the following. The first part, it contains the demographic data of the nurses as age, gender, material status, educational level, nursing experience, workplace, and the presence of children. While the second part, it included the factors affecting the nurse's stress level, which was consisted of 9 different items. While the third part, which is the nursing stress scale, and it was adopted from the Gray, Toft, and Anderson in 1981. The scale, it was consist of 34 items. The content, validity, and reliability, it was determined by a group of experts in critical and psychiatric nursing department. Their opinions elected regarding the format, layout, consistency, accuracy, and the relevancy of the tool. While the reliability test, it was showing a high Compaq alpha, which was 0.864. With With regards to the ethical consideration, each nurse was informed about the purpose of the study and the benefits of the study as well. All of them, they signed consent to participate in the data collection in advance of answering the questionnaire. Besides, they were informed that they have the right to leave and refuse the participation or to withdraw at any time. Researchers collected the data from the nurses after spending a period of 14 days in COVID-19 quarantine hospitals by sending the questionnaire after translating it into Arabic by email and other social media after sending a message explaining the purpose of the study and confirming the privacy of the data. The SPSS version 22 has been used for statistical analysis of the study. The results. First, the demographic data. Table 1 presented that 50% of the studied nurses were aged between 20 to 30 years. With regards to the gender and the marital status, 67.4 and 59.1 of the studied nurses were female and not married respectively. Also, 55.6% of them did not have children. Moreover, 70.6% of the studied nurses working at ward units. With regards to the educational level of the nurses, it was found that 54.8% of them had Technical Institute of Nursing. Also, 52% of the studied nurses had less than 10 years of experience. The second results, it's about the nursing stress scale. And in Table 2, showed that the mean score of the studied nurses regarding to the workload inadequate preparation was 21.84 and 9.92 respectively. Also, the mean score of them regarding to the lack of staff support, death and dying, and uncertainty concerning treatment was 9.41, 21.37, and 14.51 respectively. Moreover, the mean standard deviation score of the studied nurses regarding to the conflict with physicians and the conflict with nurses, it was 11.96 and 11.4 respectively. Finally, the mean score standard deviation of the studied nurses regarding to the total nursing stress scale was 99.47. While the percentage distribution of the studied nurses according to the total nursing stress scale indicated that 51.1% of the studied nurses had moderate level of total nursing stress scale. Also, 26.2 of them had severe level, while only 13.4 and 8.3% of them had mild and normal level, respectively. Third, the relationship between the staff nurses' demographic characteristics at the isolation hospital and their stress level shown that there was a highly statistically significant relationship between the total nursing stress scale of the studied nurses and their characteristics at p-value less than 0.1. Also, there was a statistically significant relation with workplace and educational level, while there was no statistical significant relationship with age, gender, and years of experience at p-value less than 0.5. Next, the relation between the staff nurses' characteristics at isolation hospital and their stress level. Table 4 showed that there was highly statistically significant relation between the total nursing stress scale of the studied nurses and their characteristics as attendance to training courses related to COVID-19, fears of infections, fears of transmission infection to their family, availability of personal protective equipment, and nurse to patient ratio at p-value less than 0.1. Also, there was statistically significant relation with the surrounding people showed that COVID-19 is a stigma and provides special attention from hospital administration at p-value less than 0.05. And finally, the multiple linear regression model. The table indicated that there was significant statistical positive effect from marital status, having children, and people showed that COVID-19 is a stigma on the nurse's stress at p-value less than 0.5. While there was a highly positive effect on fears of infection, workplace, fear of transmission infection for family, nurse-to-patient ratio on nurses' stress, while there was a highly positive negative effect of training on COVID-19 and the availability of the PPE on nurses' stress at p-value less than 0.1. Also, there was a slight negative effect of the educational level and attention of the hospital administration on the nurses' stress at p-value less than 0.5. So, according to the nursing stress scale, the results of the current study specified that the highest mean score of the nursing stress scale was inadequate preparation, workload, and lack of staff support, but the lowest mean score belonged to the conflict with other nurses and the conflict with physicians. Also, the study revealed that around half of the studied nurses had moderate level of total nursing stress scale, and also slightly more than 1/4 of them had severe level, while most of them had the fear of transmission, the infection to their family. In addition, regarding to the linear model, the results showed that the training for COVID-19, the availability of the PPE, besides to the educational level and the attention of the hospital administration, were negative predictor factors for the nurses' stress, which may be due to the knowledge about COVID-19 is limited, so training program decreasing the stress level. While marital status, having children, people showed that COVID-19 is a stigma. Besides to the effect of fear of infection, the workplace, fear of transmission infection for family, and the nurse-to-patient ratio were positive predictors for nurses' stress. Nurses' fear from infection came with 85%, while having children, it was 44.4%. And working in critical units, it was 29.4%, and all of them were suffered from high stress. Nurses were worried about the health of their family members and fear that will lose one of their family. Finally, the conclusion of the study results showed that half of the studied nurses at the isolation hospitals had moderate level of stress. Also, more than 1/4 of them had severe level of stress. Training for COVID-19, the availability of the PPE, besides to the educational level and the attention of the hospital administration, was negative predictor factors for the nurses' stress. Finally, having children, people showed that COVID-19 is a stigma, effect of fear of infection, workplace, fear of transmission, the infection for the family, nurse-to-patient ratio was positive predictors for stress among the nurses. Thanks for listening. Dr. Hadya has been with you. Thank you.